In the second part of Chapter 6, we're really going to look at how to provide care and how to safely move an injured athlete from where they're at. Maybe this is a competition field or a practice field, or maybe they're in an unsafe area that we need to get them out to provide the proper care for them. So for acute injuries, we are really looking at trying to keep the injured athlete there as much as possible at that location as we perform basic examination that we just talked about in part one. If we must move the athlete, we need to do so safely without causing any further injury or making these symptoms worse or exacerbating them. You'll see that word in the textbook, exacerbating the symptoms, which is making them worse. In any situation, you don't want to move the athlete if we suspect that they're having a head injury or that it may complicate the injury in any way or form. So, in certain instances, as you can see there, we can move the athlete if we need to complete the injury evaluation further. So maybe they're in a crowded area and the athlete will be harmed if they left the area. Maybe they're on the playing field during competition and it is safe to move the athlete with no further harm. And in general, if the athlete has mild to moderate symptoms, we're typically able to move them to a different location to really get a good in-depth secondary survey after we make sure that our primary survey is not life-threatening. But if they have very severe types of injuries or signs and symptoms, we're going to make sure that we keep them there to provide that care. In some situations, remember, we don't want to move the athlete at all because moving that athlete would complicate the injury. So we don't want to do this if they're having some sort of life-threatening or other serious situation, such as they're not breathing, they have a fracture, maybe it's a compound fracture and they're bleeding and it's sticking out of the skin, or they have a spinal injury. And really we need to make sure that any time that the athlete complains of an injury to the head, neck, or spine, and if we're not really sure, we want to keep that athlete in that position and provide care until we get further personnel such as EMS to the scene. Make sure that we're continuing to check on the athlete. Now, lastly, we definitely don't want to move the athletes if they are unconscious at any time. And if you look at these different scenarios of different serious situations, for all of these, no matter what, we want to provide care immediately with our first aid and CPR skills in these situations. We want to take the time to move the athletes to a safer location per se, and lose out on that time of actually getting treatment. So if the athlete is unconscious or they're not breathing, we want to do rescue breaths and we want to start CPR as fast as possible. Now, there are other times that we can move them, and there are different ways that we can move the athletes. And when we look at moving the athlete, and I'll go over some pictures on the next slide, but there's three primary ways that we can move the athlete. And you can see here ambulatory assistance, manual conveyance, or spine board transport. And we use ambulatory assistance for athletes that have minor to moderate types of injuries, that by having them partially weight bear or walk on his or her own, that they're not going to cause any more injury to that area. So if we look at this, we are able to assist them walking. So you'll see individuals have their arms wrapped around a healthcare provider's shoulders. There may be one, there may be two healthcare providers, but we're really assisting them as they walk off the field. And we typically see this because most athletes don't want to be carried off the field. They're going to try everything that they can do to partially weight bear at least and walk on their own with some assistance if needed. Second, we have manual conveyance. Manual conveyance it can be used for an athlete who cannot bear weight on their lower extremity or that can't walk on his or her own. And in this type of situation, we're really using a carrying method where two individuals are going to wrap their hands underneath the athlete and the athlete's going to be basket carried off the field slowly, so that we can get them onto the sideline to do that secondary survey and to provide the appropriate care. Now, if we do have one of those life-threatening situations on the field, we don't want to move the individual. We want to make sure that we keep that athlete in that position, maintain inline stabilization, and spine board the athlete or backboard the athlete. And this typically occurs if they've had an injury to the head, neck, or spine, and they're complaining of numbness and tingling in the back, in the spine, or down into the lower extremity, or anytime the athlete is unconscious. So you can see in this next slide, our left side picture is our ambulatory assistant or ambulatory aid, and we're really looking at helping them off the field with partial weight bearing. You can see in that picture they're able to touch down on the uninjured side while keeping the injured side up above. In the middle picture, this is manual conveyance. So you can see it's a basket type of carry where the athlete is sitting on the healthcare provider's hands or arms with their arms wrapped around their shoulders. And we have to make sure, we have to determine if this is capable, depending on how big you are, how big the athlete is, if this is a possible means of transport for that athlete. And lastly, on the right hand side, we can see this is spine board transport, where the athlete is strapped into a backboard and they're being carried off the field for maybe a life-threatening or serious type of injury. Next, let's look at providing care. Depending on your credentials, licenses, and other documentation and things that you hold, and whatever state that you're working in, because it determines state practice acts, what you can do, your role and what care you can actually provide varies. So we have to make sure that we are providing the right care for the state and what credentials that we have. No matter what, we really won't be wrong if we provide first aid or CPR that were recognized through the American Heart Association or American Red Cross, because we know that it may be a life-threatening situation. Even if we're not certified in first aid and CPR and we're providing first aid to an injured athlete, it can be covered in your state's Good Samaritan laws, and you should be protected. Now, when we're looking at our licenses and credentials, typically one of the biggest things that we could do to provide care initially after an acute injury is to use the RICE method. And the RICE method stands for rest, ice, compression, and elevation. And we can use this type of acronym or type of care in any situation for an acute type of injury. So when we're looking at rest, after we get them off the field and we complete a secondary survey to see what the injury is, we are going to care for them with rest, which can be teaching them how to use cane or crutches, or possibly a walking boot so they rest that injured body part, or maybe placing them in a sling so their upper extremity can be rested. Now, resting the injured body part will give the body part a chance to heal properly. Rest is particularly important for an acute type of injury, especially in the inflammatory phase. However, too much rest for long periods of time can be detrimental, and we'll lose strength and range of motion if we rested too much. So this is a slide about rest, and we want to make sure that we rest for really a good amount of time throughout that initial inflammatory phase by using crutches or a splint or some sort of aid to help rest that body part. But like I said, if we rest for too long, it can be detrimental because we'll start to lose muscle strength, we'll atrophy the muscle, and we may lose range of motion as well. Second part of this process is ice. Ice facilitates the healing process. When we're looking at the healing process, ice helps decrease nerve conduction, which helps decrease pain signals to the brain, acting really as an anesthetic and decreasing the capillary permeability, so it decreases the blood flow. It makes the blood more viscous or thick so it doesn't bleed as much, and decreases the swelling. Now, we have to make sure that when we're using ice, we must take some care for areas of superficial nerves. This occurs at the elbow as well as the knee. So we want to make sure that we provide care, because if we freeze the nerve, then they'll have no sensation in the area and could become injured again. Typically, when we apply ice, the time for ice application is between 5 and 20 minutes, depending on the size of the treatment area and the tissue depth of where the injury occurs. This is typical providing ice. So on the left-hand side, we can see a bag of ice on a knee, as well as on the right-hand side, an ice cup. So depending on the situation, we can use these. Typically in an athletic situation, or maybe personal training in a gym, we're going to go to a bag of ice or a reusable ice pack and use that. Sometimes in PT settings, we see ice. We may also see bags of peas or other frozen vegetables that form to the body part well to get that anesthetic feeling around the area. Third, we have compression. This is the C part of RICE. Compression, we really want to try to mechanically apply pressure to the injured area. This helps support the injured area and the surrounding structures, but it also aids in moving edema out of the injured area, which helps promote healing, which helps promote increased range of motion throughout that healing process. Most times we're going to use an elastic bandage or an ACE wrap or a commercial neoprene sleeve that the person can slip over their injured body part. When we look at an elastic wrap or elastic bandage, you can see that around the ankle, or on the right hand side, that picture is of a neoprene sleeve that we can use for compression. Elevation is our last part of RICE. This is where we'll finish up our care part. Elevation is used to assist decreasing edema as well, just like compression. But in elevation, we're going to elevate the body part above the heart, because as we elevate and go above the heart, this will help return the extra swelling and extra fluid from the injured body part back to the center of the body and have it circulate through the body. So with our compression and our elevation, it really helps to quote unquote speed up that injury process, because we get the swelling out a lot quicker. So we're using really the circulatory system with elevation to transport waste products and fluid out of the injured area, so we heal at a faster rate. This is a typical what you see. So we're looking at compression with an ACE wrap as well as elevation. This is on a kit or an athletic training kit. Could be on a table, could be on the ground. We can also use ice in this situation, put ice underneath the ACE wrap as well as elevate, and have all three of those elements. And as you can see, they're not walking. So we're really getting all four parts of RICE in this, could be in this proper care at this point in time.